Okay, it's time to get answers to some of your questions on the coronavirus. And joining me today to answer them is Chris Smith, the virologist and presenter of The Naked Scientist. He's in our Cambridge newsroom. Lovely to speak to you today here on BBC News. So we're going to get right in there. Obviously, there's a lot of confusion and questions that remain unanswered. So Sylvia is going to kick us off, and she says, will wearing plastic gloves in public help minimise me contracting the virus?
Probably not, actually, Sylvia, and the reason is that this virus wants to gain access to what are called your mucous membranes. It wants to get access to your nose, your throat, or to do that via your eyes. So if you touch a surface wearing gloves, OK, if you peel the gloves off and throw them away, then anything that's on the gloves won't go near your mucous membranes. But if you touch anything while wearing the gloves, you can still transmit anything that's on the gloves to your eyes. So if you touch your face, touch your fingers into your nose or your mouth, you could still transmit viruses on the glove surface. So really, to be honest, because the virus can't actually infect you through your normal skin, it's better to just wash your hands with soap and water to guard against that route of entry.
So just reiterate for us, mucous membranes, where are they located?
Well, anything which is a soft and squidgy bit in your body, really. So that means your nose and throat, your naughty bits and your eyes. Now, this virus infects via the nose and throat. So those mucous membranes up your nose, down your throat, into the lungs, and also the surface of your eyes.
OK. Well, Peter says, do I need to clean parcels that are delivered to my house?
Hello, Peter. The answer to this one, and people have looked at this in some detail, because they're asking the question, what is the dwell time? How long does a virus particle of this type last on a surface? And this is important because when we want to clean up, when someone's been in an area and they've been shedding this virus, we need to know how much risk there might be from, say, furnishings, soft surfaces, etc. So people have looked at viruses like the coronavirus and also like flu, and the answer is that this is what we call an enveloped virus. The outside of the virus is covered with an oily membrane, the envelope, and that's why it's vulnerable to alcohol, because when we clean our hands with alcohol hand rub, it breaks apart that envelope of the virus, and without that being intact, the virus can't infect you. That does, though, make the virus very fragile, so it tends to be on a surface and intact and capable of infecting only for minutes to hours. So parcels coming through the post and that kind of thing, we think the risk is minimal.
So does things like bleach break through that membrane?
Yes, bleach will actually kill pretty much every virus we know about, both the envelope types, like coronavirus, and so-called non-enveloped viruses, which are things like norovirus. Norovirus is very, very infectious, and because it doesn't have that envelope around the outside, it's just a tough particle, it will survive on surfaces for weeks to months, which is why we're actually in a good position with this virus. It's much easier to disinfect. But yes, alcohol, bleach and hydrogen peroxide as well is very good at getting rid of it. But don't put that in your eyes.
No, absolutely. Now, we've been hearing about a new strain that may have developed. No confirmation yet, but there is concern. I mean, obviously, this virus jumped from animal to human. So Edward is asking, is there a chance that this virus could mutate and worsen?
All viruses can mutate. What does mutate mean? It means that the genetic information of the virus can change. And some viruses do this a lot. If you take the norovirus I just mentioned, this mutates so ferociously quickly that you can catch it again within 6 weeks of last having it. Other viruses mutate only very slowly. Viruses like the herpes virus that causes cold sores, or the measles virus which causes, well, measles. They mutate so slowly that you get vaccinated or you catch them once, you never need to worry again. This new virus, we're looking at this quite carefully, and people are comparing samples that are coming out of patients now with samples that were gathered right at the beginning of the outbreak in China, and they're comparing the genetic code of those different samples, and you can see where the virus is changing and how rapidly. And reassuringly, the changes appear to be happening only very slowly, and they're not affecting either the rate at which the virus spreads or how nasty it appears to be. So we're comfortable at the moment that there's a low risk that this virus is suddenly going to weaponise in some way through mutation and become much nastier.
OK, now, I think this next question from Kath perhaps goes to most people with these compromised immune systems that we hear about who are most at risk. So Kath asks, should asthmatics take special precautions to protect themselves from the virus? What can you do?
People who have asthma have a range of symptoms. Some people have very mild asthma, for instance exercise-induced asthma, or when they go out on a cold day they might get a tight chest. Those people are probably at minimal risk. Other people, on the other hand, have more severe asthma, and those individuals might need to take drugs that suppress their immune system in order to keep their asthma under control. Asthma is an allergy. It's an allergy to house dust mites. And so in order to keep it under control, you usually take drugs like inhaled steroids, when you take a puffer that delivers some of the steroid to the surface of the lung, and this depresses the immune response in the lung and makes the lung less reactive, and therefore you have fewer symptoms. There is some spillover systemically around your body, and some people have such severe asthma that they have to also take systemic steroids. In other words, they take tablets which depress their immune system, and that will affect the entire body. For this reason, anything that affects the chest and an immune suppressant will make you more vulnerable to the effects of this virus, and in fact any kind of respiratory virus. So you should try to take steps not to catch it. Now that's easy to say, easy for me to say, it's very hard in practice to do, but if you do think you're getting unwell, you should call for help, because it may be that the symptoms are going to be worse in you and steps need to be taken to make sure you stay well.
Okay, well, is there anything that can be done for somebody who does have a compromised immune system? I mean, pregnant women have lowered immunity in order to protect the fetus. Is there anything you can do?
It's interesting you highlight the effect of pregnancy, because that was one of the big concerns right at the outset of all of this, because some viruses, when they do infect a woman who's pregnant, do produce more severe manifestations. A really good example of this is some of the hepatitis viruses. If a lady catches that while she's pregnant, she can develop very severe symptoms. That doesn't seem to be the case in this instance, so we're reassured that women are not at serious risk over and above their normal risk for their age if they're pregnant. The other major concern that anyone who's pregnant has is, will this damage my baby? The answer here is this virus does not go across the placenta, as far as we can tell, and therefore it won't get into your baby and cause damage to the baby over and above what damage could occur if the mother's unwell, because any kind of infection in pregnancy does increase the risk of anybody having a problem with their pregnancy, but that risk is really small here. If you are in a group who has a depressed immune system because you're, say, an organ transplant recipient and you take immune suppressing drugs, or as we've just been discussing, someone who's asthmatic and takes drugs for asthma, there is a risk that you will develop a more severe illness, but that's no more severe than if you caught, for instance, the flu. And most people who have had transplants or know they're at risk have already become very sensible. They know how to stay well, and they already exercise caution, and they do tend to take steps in order to minimise catching these sorts of things. They say to their friends, look, please don't come over if you've got something because I don't want to catch it. Or they don't go to places where they know there will be lots of people who are going to have an infection. So really that sort of common sense approach is the best way forward here.
OK, Pam asks, if I do contract the virus, for how long would the symptoms last? Do we know that yet?
No, we don't. And this is a really good question, Pam. And it varies from individual to individual. As far as we can tell, it varies most discriminately by age. It's a very ageist virus, and also discriminates against men as well. So I'm potentially in trouble because there are more men catching this than women. But what we know is that very young people seem to have very, very low levels of symptoms. Therefore, we don't really know how long they're symptomatic for or how long they're shedding the virus for. What we do know is that people who get severely unwell tend to get worse and worse by the day, and the incubation period seems to be about 4 days on average. The longest documented reliably is about 11 days, the shortest 1 day, and people then day by day seem to get incrementally worse symptoms, so that if they're going to get really bad, by about a week into the illness the symptoms peak and then they improve. So it probably is going to follow a similar pattern to flu, where most people end up with the symptoms peaking after about 3 days, and then you just feel washed out and not very well, but better largely by 5 days.
OK, this is a question from Josephine, links in quite nicely with what you said about cath and asthma. But Josephine says, my husband and I are elderly and both have chronic lung conditions. When should we self-isolate?
Hello, Josephine. Well, the bottom line is, at the moment, the amount of virus circulating in the community, as far as we can tell, and this advice may change, of course, and one has to react dynamically to these sorts of situations. At the moment, the level of circulation is extremely low, and therefore your risk of catching this from going about your daily business remains extremely low. So at the moment, there are no grounds to isolate yourself, but if you become symptomatic or you come into contact with someone who is, and therefore you may be at risk of having caught it, that's the point at which one would put oneself into self-imposed quarantine in order to make sure that you don't give it to somebody else. And if you are going to any doctor's appointments or clinic appointments, that kind of thing, why not ring them, warn them that you've got some symptoms and ask, perhaps could I be put at the end of the list? Because that way you're not going to sit in a waiting room with people who are equally vulnerable and potentially infect them. You'll still get the care you need, but you'll be placed at the end of the list, meaning you won't threaten anybody else, and it's very easy to just clean the room after you've been through, and then no one's at risk.
OK, Dr Smith, our last question comes back again to killing this virus, and I think this is what people are really wanting to understand. Jane says that I run a toddler group. What's the best way to effectively clean a large volume of toys? I've heard that freezing them can help.
Probably not, because we actually in our laboratory store viruses in the freezer, and actually in the right conditions they'll freeze down quite nicely and they're perfectly happy, and then you thaw them out and you can infect things with them again. So freezing's probably not going to cut it. The best way to clean up, toddlers slobber all over each other and all over the toys and things. They put them in their mouths, for example. So toys and that kind of thing could end up covered in viruses. Therefore, swabbing down your toys with either an alcohol solution, same as the stuff you find in hand rub, or a weak bleach solution, or peroxide solution, the same stuff you use to clean your contact lenses actually, will get rid of this virus, and that would be my advice. One other approach, you could put them in the dishwasher. Some people put toys and things in the dishwasher, run it through on a nice hot cycle. The detergent in the dishwasher and the temperature, that combination is just like washing your hands really well with soap, and as long as the toys are dishwasher proof, obviously, and you're not going to eat off them afterwards, don't put them in there with your crockery and knives and forks and things. That will be a really good way of cleaning up a lot of stuff very quickly all at once. OK, Dr Chris Smith, the Naked Scientist, thank you for stripping back to the facts on the coronavirus. Thank you very much. And thank you to Sylvia, Peter, Edward, Kath, Pam, Josephine and Jane for your questions, hopefully all answered.